Corey, I understand that you went to the urgent care. Could you tell me what happened and what they did for you?
Sure. Yeah, I play hockey on the weekends, and I fell, took a bad fall into the boards, hurt my shoulder. Went in there to let them know, and they gave me a prescription for some of the hydrocodone to help out with a lot of the pain and sort of get me back up on my feet.
And how's that working out for you?
The hydrocodone worked really well. It took away all the pain, and it was just real easy to get back on my feet.
And do you have any of those left?
I don't. Now I actually ran out of those, and I still had a lot of soreness and pain and stuff like that. So I had a prescription left over from when I got a tooth pulled a few years ago, and I never actually finished that off. So took a few more of those and was looking to try and get some more to help because it's still hurting.
Yeah, and I see that the x-rays were negative, so it's a musculoskeletal pain.
Yeah.
Have you tried things like Tylenol or ibuprofen or even some ice and heat with that?
Yeah, we did the usual post-injury stuff, icing it and doing all those sorts of things, 20 on, 20 off, 20 off, Tylenol, some of that stuff, but none of it really worked as well. You know, it might dull it a little bit, but it didn't actually take it away so that it felt better.
And that's when you went to the hydrocodones because they worked and took it all away. How about physical therapy? Anything like that? Would you want to try?
No, we got so much stuff going on, and it's easy to just take something and not have to worry about interrupting the flow of the day and getting out of work and going anywhere like that. So I'd really just prefer to have something that I can do like that, and I'm sure it'll go away within a little while anyway. It's just still lingering a little bit. I'd like to get rid of it.
Do you think we'd want to try the Tylenol or the ibuprofen again? Maybe that'll work this time since it's calmed down a little bit.
I mean, I don't know. I feel like I already tried that, and since it didn't work, it would just be better if I could stick with what works, and I know that it's going to help, and just sort of go that way.
So you really stuck on the hydrocodone.
Well, you stick with what works, right?
Well, yeah, but there's the good and the bad with that.
Okay.
Do you mind if we talk with the clinical pharmacist, Kate? She's right in the building.
Okay.
She can go over the medicines, tell you a little bit more about the hydrocodone, and maybe even have a few more ideas for you what we can do for your pain.
Okay. Yeah, sure.
Great.
That sounds good.
I'll give her a call, and then I'll go and give her the scoop on what's going on, and then we can talk with you again.
All right, sounds good.
Kate, thanks for coming down for the
happy to
consult.
help.
I have this 35-year-old gentleman. He plays hockey. Hurt his shoulder and went to urgent care.
Okay.
They saw him, x-rays were negative. They gave him some hydrocodone for a few days.
Okay.
He used those all up. Now he comes back and he wants more.
Okay.
He's not really into the Tylenol or the ibuprofen. He says they
options.
don't.
Okay.
Correct. The kicker is he had a tooth extraction a while back, saved some of the hydrocodone, and started to use that again, supplementing. So I thought maybe if you would talk to him, come up with maybe some other pain options, give him some
happy to do that.
education. Perfect.
Okay, sounds good.
Corey, this is Kate. She's our clinical pharmacist.
Hi, nice to meet you, Corey.
Telling
Nice
you
to meet
about.
you.
I'm going to leave you guys to talk, and then
Okay.
we'll come back and convene with you.
All right, sounds good. Thank you.
All right. So I heard that you had an unfortunate accident with the boards and hockey on there. Tell me a little bit more about kind of the pain that you're experiencing in your shoulder.
A lot of it is typically first thing when I wake up in the morning after, because I tend to sleep on my side at night, so I think it gets a little bit pinched up. And then throughout the day working, I type a lot, and it just gets this real soreness and just a lot of the motion stuff. And I know that they took the x-rays and there's nothing wrong with the bones, so it's just the muscles have got to take their time to heal.
Do you notice that the pain kind of stays in one spot, or does it like move down your arm?
No, it's just mostly right in the around the joint, that sort of area. I had some ligament injuries in high school when I was playing, and it feels somewhat similar to that.
Okay. based on the kind of old injury, do you still have pain from that injury in high school before you had your most recent?
No, fortunately that one was actually the other shoulder.
Okay.
That one's doing pretty good though. It's just recently with the collision.
Okay.
It's really causing any issues.
Okay. I know that Henry had you fill out some information before we came and see you. Do you mind if I go over that with you?
Not at all.
So we had you fill out a scoring tool called the Opioid Risk Tool, and what it does is it looks at patients who are taking opioids and what might be some risk factors that they may have that might make them more predisposed to developing addiction with these opioids.
Okay.
On there. So it looks at family history, it looks at kind of your personal medical history on there, any mental health, your age on there. And when we went through and did the scoring, it placed you at a kind of moderate risk for developing some opioid use disorder on there. You seem kind of surprised about that.
Yeah, I don't know. It just seems like something, you use, you get hurt, you take care of a few things, and when it goes away after it heals up, you're good to go. I don't really think about, having some kind of an addiction or anything.
Right.
Just want to get better and play hockey.
Understandable, and obviously something that you still have a passion for, to be playing, as an adult, and not the same as playing in high school on there. So one of the concerns, we've actually had a lot of new information that's come out in the last couple of years, is trying to kind of limit our use of opioids. Opioids can be helpful for some types of pain, for periods of time when you have an acute injury.
Right.
But we know that with longer term use, it doesn't necessarily big picture really help with a lot of this acute pain. The other kind of piece of it too is medicines are only a small part of treating pain. Doing things that don't have to do anything with medications, like putting ice packs in or using heat, physical therapy. Those are also things that are really important, kind of big picture for treating pain.
Yeah, we learned a lot of that when I was younger with the ice, and then 20 minutes on and 20 minutes off and that sort of stuff, and it helped out, especially in hockey. You get a lot of ankle stuff, so
I'm sure.
we did some things with those, but it's kind of hard to raise a shoulder, elevate a shoulder, so
That's
it's
true.
just trying to figure out the ways to be able to take care of that, and just part of it is just you also stick with what works, and I know that it really did take away a lot of that stuff. So I guess I never really thought about it being anything more than just, with stronger Tylenol. I guess is how I was thinking about it.
And I think we're kind of at the point thinking about when you had your injury, and the body should be working to kind of heal itself there, and we need to start thinking about transitioning to things that are non-opioids to treat your pain, because again, trying to balance that risk versus benefit with the hydrocodone, that's not something that we want to be using long term. Have you tried other things for pain in the past?
Yeah, I tried some of the Tylenol, ibuprofen. I had heard from a friend of mine that Aleve sometimes helps because the inflammation, bring down the inflammation a little bit, and that can help with some of the pain go away, but none of it really worked as well.
Okay. So we have a lot of different medications that are in kind of that same family of medication as the ibuprofen and the Aleve that you've taken before. Would you be open to trying another medication in that class?
Well, I could think about it, but it's just, it's hard to go away from what, works even, with anything else. So I just really want to kind of get through it, get out the other side, So.
Would you be open to doing some other kind of interventions, like maybe having a physical therapy referral?
Part of the problem with that is that you got to take time out of your day and go do something. And, with the work that I've been doing, I would worry that I don't have the time to get out there, and it's just easier to just, take something and carry on with your day. especially if it's not going to last that long. You know.
Okay, and that's, you know, that's a real concern on there. Well, let me go and touch base with Henry and kind of bring him up to speed on what we talked about, and we can kind of figure out what's going to be a good next step.
Okay.
Okay, Corey, I talked with Kate, and we talked about the different things that she had talked with you. We talked about that screen, that opioid screen that you did when you initially came in, and that was a little bit concerning to us. You took all the hydrocodone from the urgent care, which is fine because that's what it was prescribed.
Sure.
But then you saved some from when you had your dental work done. You started taking that.
Yeah.
So with that screen, there are a little bit of concerns.
Okay.
So together, what we're wondering is if you would mind meeting with Alicia. She's a therapist that works here.
Okay.
She'll go over that screen and have a few other questions just to make sure there's no other issues that we need to worry about. And then we can get together and go on and manage your pain a little bit better.
Okay. Yeah, that'd be fine.
Okay, Corey, this is Alicia. She's one of the therapists from upstairs.
Nice to meet you.
Very nice to meet you.
I had a chance to talk with her, so she knows that you met with Kate and the things that we've talked about.
Okay.
And I told her about the opioid screen and some of the concerns that we had with that. So I'm going to leave you to talk with Alicia, and then we'll be back and tie things up.
All right. Sounds good. Thank you.
Great.
Hi, Corey. How are you?
I'm well, thanks. How are you doing?
I am well. I understand that you've been here for quite some time today.
Yeah, a little bit, yeah.
Okay. So I understand that you had a sports injury, was it?
Yeah, hockey.
Okay. Was it your shoulder?
Yep.
From my understanding?
Yeah, my right shoulder.
Okay. So just to recap, so we don't have to repeat everything that you've already talked about. So you had a sports injury from hockey to your right shoulder. You went to urgent care and you got some hydrocodone?
Yes.
Was it? And then that ran out, and then you took some old hydrocodone?
Yeah, I didn't use it all
Okay.
when I had a tooth pulled.
Oh, okay.
And so I had some left over from that, and I realized it was the same stuff in the same amount. So
Okay.
I just figured since
Well,
the pain wasn't gone, I could grab a couple of those.
Right. I'm sorry you had that injury. That had to be
Thanks.
pretty painful.
Yeah.
Okay. So, and I also understand that Kate did an opioid screening with you?
Yes.
Okay. What are your thoughts about that?
I don't know. I guess it's not something I ever really thought about.
Okay.
You had injuries before, and you take your meds, you do your ice, you do that sort of stuff, and you're just good to go when you're done healing up.
Absolutely. So I think the process that we're going through today is to kind of support you with your pain, and also be mindful of the opioids that you are taking and that you have been taking. And when there's a little bit of a concern that comes up, we like to address it in the beginning, because as you know, there's a huge opioid epidemic in the community. So we're trying to be proactive about the prescriptions and things like that.
Right.
And being that you took the script, I guess you ran out before it was due to run out, or the time frame?
The last ones that I just got from
Urgent care?
Urgent care? Yeah, they had given it to me for 10 days, and then at the end of 10 days, there was still the pain was still there, and so that's why I grabbed the old stuff.
Okay. Did you take it as prescribed?
Yes.
Okay.
Yep.
Okay. Corey, do you have any history of addiction in your family?
No.
Okay. Is there any history of illnesses or things like that in your family?
Not really. I mean, my dad's hard of hearing.
Okay.
I don't know if that counts. Some hearing loss, that sort of stuff. But nothing to speak of that way.
Okay. So what it sounds like is the pain that you're experiencing is going to be painful, considering the injury. I'm not the doctor.
Sure.
But from what it sounds like, and after speaking with your providers, that the hydrocodone is not something to continue to prescribing. It also can have addictive qualities to it, and that's not a pain medication that we will want to prescribe long term. So would you be open to trying anything with non-addictive qualities, maybe some ibuprofen or more a different type of pain management?
Well, You know, they had mentioned the Tylenol and the ibuprofen. I tried those, and it's
Okay.
still not, you know, it's not to the point where that's really taken it away.
Okay.
And, you know, I just would be concerned, as I mentioned before, about, you know, trying to do some physical therapy or something like that. And it's just so hard to get out during the day. You know,
Absolutely.
you're working all day and all
Absolutely.
that sort of stuff. And just, you know, I understand the concern. I've seen the specials on TV and all that sort of stuff. But,
Right, right.
you know, it's just, it's hard to break away from something that, you know, that's working.
Absolutely,
So.
absolutely. And this might be something that we just have to give it time to heal.
Okay.
Just like getting a cut, we can't keep a Band-Aid on it forever.
Okay. Well, that's
You
true.
know, because as long as you keep that Band-Aid on, it'll get mushy and
Yeah.
gooey. But as soon as you expose it and take the Band-Aid off and letting it get the air that it needs, it starts to heal.
True.
So just maybe allowing yourself the time to heal.
Okay.
And maybe slowing down a little bit in your routine. Are you still at work?
Yes.
Okay, so maybe taking it a little easier, and just to reduce the risk of re-injuring yourself.
Okay.
And outside of ibuprofen, maybe there's something else that you can talk about with your physician
Okay.
that is a little bit stronger, but not an opiate and doesn't have the addictive qualities.
All right.
Would you
I
be
mean,
open to that?
yeah, we can give it a try.
Okay. All right. So what I'll do is I'll go get your doctor and touch base with him,
Okay.
and then I'm sure he can come up with a medication that would be appropriate for you and
Sure.
your pain.
All right. Sounds good.
Okay. I hope you feel better soon.
Thank you very much.
You're welcome. Okay, Corey. So your physician is back, and I touched base with him and let him know that I don't have any concerns for you right now as far as possibility of addiction and opiates go right now. I don't see any concern or anything for you to engage in any type of outpatient setting for chemical dependency. I don't think you're at an abuse level right
Okay.
now. I don't think that opioids would be something to continue using long term. However, I will leave that up to your doctor to prescribe and discuss that with you.
Okay.
Okay, so we just wanted to come back, reconvene, and have a conversation with you and let you know what we talked about.
All right.
So what we'll do is we'll give you an appointment, okay, in a few weeks. I'm going to put you on a non-narcotic anti-inflammatory. Let's try it, see how that works.
Okay.
And then when you come back, we'll see if Felicia's around. You can meet with her and see what you think. If you needed to speak with Kate, we can always arrange that too. But for now, I think we'll give you the non-narcotic anti-inflammatory, set you up for appointment, and see how you do with that.
All right. Sounds good. Thank you.
Perfect.
All right, thank you for your time. I hope you feel better.
Thank you. Thanks very much.
Yep.